Whilst there is significant positivity about the opportunity the health tech sector presents, the reality is that today significant barriers exist impacting UK patient access. And so, over the last 12 months, ABHI has had the privilege of working closely with our members, with relevant stakeholders from national and local NHS leadership, from patient groups, think tanks and officials, to develop a programme for government, a 10-point plan for how to realise the full potential of the health tech sector in contributing to the health and wealth of our country. And so today, on behalf of the ABHI membership, I am thrilled to present to you their plan for health tech. 3 of our board members will now take you through the 3 themes of the plan for health tech and invite you to engage in their delivery. First up is our chair and CEO of UK SME, Eshman Technologies, Phil Kennedy.
As part of our programme for government, ABHI's Manifesto, the plan for health tech, calls for swift and effective action to build a truly world-leading regulatory system. One that improves patient safety, improves and enhances patient access, and of course, encourages innovation. The next government, we believe, need to focus on 4 key areas with respect to regulation. Firstly, recognising approvals from other jurisdictions, such as the US and the EU. Secondly, developing swift and effective innovation processes, such as software as a medical device roadmap. Thirdly, switching regulatory resources towards a more post-market surveillance activities to support innovation. And finally, to develop innovative models of regulation, such as we've called for in the past, outcome-based collaboration models. The UK has an international enviable reputation for regulations that are pragmatic and effective and enable innovation. We need to build on this as the engine for our sector to grow and to capitalise, despite a system that's under huge pressure, on the many technological advances that are happening in our sector every day.
Now we'll hear from our Vice Chair, President at LivaNova, Stephanie Bolton, on the need to professionalise innovation and adoption.
Hi, I'm Steph Bolton and I'm the current Vice Chair of the ABHI. The HealthTech Manifesto is a comprehensive overview of our industry and its extensive role within healthcare. It also sets out a clear call to action with a view on the current state and the much needed future state and a subsequent list of priorities, one of which is the role of innovation, where adoption is key to unlocking the health tech sector's potential. We would ask any incoming government to work immediately with NHS England to prioritise resource and pathways for development and adoption of innovation. In the short term, this could include using the CQC's well-led framework, providing clinical time and carve-out roles for innovation. And in the longer term, there should be a focus on reviewing existing adoption processes, moving towards a passport model to ensure adoption infrastructure is fit for purpose, allowing those proven solutions to be easily disseminated at pace and scale. We must build on the UK's strength in early stage research and provide effective mechanisms to support and ensure access to innovation for patients and clinicians.
And finally, Chair of ABHI Public Affairs and Government Affairs Director at Stryker, Dan Jones, on the need for a long-term approach to investment in health tech.
I'm Dan Jones, Government Affairs and Market Access Director at Stryker and Chair of ABHI's Public Affairs Group, and I'm here to support the launch of ABHI's plan for health tech. I'd like to focus on Part C of the plan that looks at how we need to take a longer-term approach to the investment in health tech. We'd like to see a change to the rules around capital equipment to help support the capital backlog that currently exists within the NHS. We'd also like to see the NHS remove the need for a return on investment to come in year one and to improve investment in digital equipment to ensure we have a 21st century service.